Hello, everyone. Thank you for AIDS Concern to allow me to talk about some clinical, cases. This is more kind of like a sharing of my, the practice that I have in Hong Kong. I don't have fancy figures, but from my perspective in the ground level, I try to share with you what I see, on a day-to-day basis. So hopefully, you guys can get a glimpse of what we see, in the day-to-day in primary healthcare. So the goals is to, for me today, is to share with you how to optimize sexual health and well-being amongst the LGBT community and the community at large, and to demonstrate some effective clinical strategies I found to promote sexual health and well-being in all patients. So I'm going to share with you two cases. So case one is a 26-year-old Indonesian man who came to see me just last month, complaining of, quote, an anal discharge for 2 days. He was worried about a so-called anal fissure. So right off the bat, when someone comes and describes these terms that are quite medical, I would wonder, like, how did he learn these terms? So actually a year ago he presented with a similar complaint to an outpatient clinic, not with me, and was prescribed an antibiotic. So of course he already had some knowledge of what was going on, but of course he was concerned and wanted me to verify that. He had, upon questioning, a past medical history of generalized anxiety and was taking some anxiolytics, Xanax, as needed. He has no history of drug allergies. So, some of the things that primary care physicians were very good at doing is just, sitting back and observing, being aware of so-called nonverbal cues. So the gentleman was an office worker, very well dressed, but during the whole consultation, he was avoiding eye contact. He only spoke when I asked him, so he was quite quiet. And on physical examination, his blood pressure was quite high at the offset, 150 over 100, and heart rate was quite fast at 90 beats per minute. After sitting down, I asked him to take some slow deep breaths. Clearly, he was anxious, so that allowed him to kind of calm down and really gather his thoughts so that he can, give me a good history. So I didn't waste too much time, and I asked him, so what, tell me a little bit about your sexual history. And what he shared was he had receptive anal sex with condom 1 week ago with a casual male partner. And he noted some, quote, pus discharge from his anus. So obviously that was the real reason why he wanted to see me. So my job was to kind of, figure out what exactly this discharge was about. So during the physical examination, he appeared quite anxious. I asked for a consent to have a chaperone with me, so that because this is a very sensitive examination, really required someone there to give him some peace of mind. So on examination on the outer anus area, I didn't see anything, no obvious redness, rashes, lesions, or any sinus tracts. And then I had to use this little device we use at the office called a proctoscope. So this is a tool we use sometimes to clearly look at the inside of the anus, and this can cause a little discomfort. So whenever you counsel patients, you have to warn them that this could be a little bit uncomfortable. So when I inserted the proctoscope, I did not see any tears, any fissures. The anal lining was completely normal. And then lastly, I had to do we call digital rectal examination to actually feel the inside of the anus, so that I couldn't, to make sure that there's nothing else in there. And there were no obvious masses, no blood or pus noted. So my working diagnosis at that time was, the presenting complaint, a perianal discharge. And on top of my mind, there were some of these things I had to make sure that this patient did not have, namely an anal fistula, which can present with a purulent or serosanguinous discharge. Other things could be a pilonidal sinus, which are also things that can cause this kind of complaint. There's also some skin lesions, like sebaceous cysts that could also present with that. And then finally, he mentioned about anal fissure, which is actually a tear in the lining of the anus. So luckily, for this patient, there was none of these serious conditions that I could identify in the gentleman. And you know, the treatment for him really was reassurance, telling him that there really isn't anything too serious. He did not require any antibiotics. And I you know, obviously told him we should continue to observe. But the things that he needed to be aware of is the next 2 points: patient education and opportunistic screening. So it was important for me to make sure that whenever he engages in, you know, sexual activity, he is nice and relaxed, because I think what was probably happening was he was very anxious, and without proper relaxation, when you engage in anal sex, you could cause a lot of trauma, discomfort, even some kind of mucus discharge from there. So it was important to educate him, like, okay, you need to be, you know, prepared mentally before you can engage in this type of activity. And then the second thing is really opportunistic screening. So this was a great opportunity to really start discussing about certain things. So this gentleman is a gay man or MSM population. And the important things we need to highlight is sexual health screening. When was the last time he had any, you know, STI screenings done? Was he aware of his HIV status? Even though he mentioned he was wearing condoms, you know, you cannot, you know, be 100% sure that that was always the case. So it's important that anybody who comes into the office with a sexual health complaint is aware of their HIV status, and asking him whether he's heard of PrEP, and discuss so-called high-risk sexual activity, the risk of contracting HIV, and lastly, vaccinations. So this gentleman actually has taken PrEP before. In fact, he's taken before, and the biggest issue for him was that he was having back pain, and so he stopped taking it. So for us as primary care, it's important to be aware of patient's ideas, concerns, and expectations. We call ICE. He really was, the reason why he stopped was he was worried that it could have caused his kidneys to be damaged, and that's why he stopped taking it. So my job was to address those misconceptions, and clearly PrEP if taken properly, is very safe. And if he was worried about his kidney, we could check his kidney function and to make sure it's okay. But with him being, you know, high risk of contracting HIV, it was important to counsel him, you know, why is he not taking it, and that he should be taking it, and having access to it is important. The second issue is, you know, taking a proper sexual health screen. So his last health screening was 6 months ago, so it was important to discuss about repeating an HIV test, running other things like a syphilis screen, and doing a swab for gonorrhea and chlamydia if necessary. And then also discussing, you know, what constitutes high-risk sexual activity, meaning having multiple sexual partners, having receptive anal sex without a condom, you know, and also discussing, you know, things like needle sharing and drug use, because all those things can increase your risk of contracting HIV. Luckily, he was a patient who said he always uses condoms during sex, and he did not have any history of illicit drug use, so that is a protective factor in a way. The other thing to bear in mind is hepatitis. You can also get you know, STDs, you know, not just the ones that are common, like hepatitis A and B. He wasn't aware of his status, so we had to check his antibody levels, make sure that he has protection, and then lastly, vaccinate him for monkeypox and meningitis, because the MSM population also has that risk. So for this case, the main key learning points is that LGBTQ patients frequently carry a lot of anxiety and shame into the office. They frequently hide their sexual orientation and gender identity due to social stigma, and this is something obviously we need to work better at changing. And so they feel embarrassed, obviously, talking about, you know, things that have to do with sex. So as a clinician, our job is to make sure that they feel comfortable, you know, opening up to us, so we can make the proper diagnosis, being extra sensitive to this particular population. Ask open and closed-ended questions skillfully. That's always not very easy to do if you're not used to doing it, but if you do it more often enough, you will know when is the most appropriate time to ask direct questions and when to ask more kind of general questions. And always see taking the time to really listen to them first use the appropriate language, because sometimes some language can be quite sensitive and patients may feel a little bit offended. So always avoid being sounding judgmental. Okay, so that's case number 1. Case number 2 is a gentleman. He's a 34-year-old heterosexual Caucasian man. The reason why I chose him is because we always talk about LGBTQ, but we mustn't forget the general population as well. We have people who also have risk factors. So this gentleman came to see me last month complaining of a left groin swelling for 2 months. And he was worried that the groin swelling was related to HIV infection. And upon questioning, he told me he had unprotected oral sex with a female sex worker in Thailand in December. And he did wear condoms during vaginal sex, and he didn't engage in any anal sex. So these are some things that I ask universally to any patient who comes in, even though he's straight. You should still ask them whether there's other types of sex you can engage in, anal sex or vaginal sex. So it's not something just because someone is gay doesn't mean he doesn't do other types of sex, and that's just because someone is straight, he can also do other things. Anyways, so this gentleman, he was quite smart in terms of because he was worried about HIV post the encounter, he actually immediately took the post-exposure prophylaxis for 1 month. He took the pills that he got from Thailand, and then after he finished taking it, a week later, he actually went to get an HIV test to make sure that he was truly negative. But still, he was still worried about possibly getting HIV from that groin swelling. So upon further questioning, he did a full sexual health screen at the Adventist Hospital, which is one of the private hospitals here in Hong Kong. And then they also got an ultrasound scan and found that the groin swelling was a lymph node, it's an enlarged lymph node about 1 centimeter in size. This gentleman, he's from France, so he actually had a GP in France and who he communicated with, who recommended doing some blood tests, including a blood count, liver, kidney function, testing for Lyme disease, brucellosis, viruses like CMV and Epstein-Barr, TB and sarcoidosis, just to figure out what's the cause of that enlarged lymph node. And he also recommended the patient to do a CAT scan to make sure, to figure out what was going on to the groin. So obviously when he presented all this information to my office, I was like, oh, okay, let's step back and think, do we really need to do all these tests? What is really going on? He was obviously also worried about cancer, because if you Google internet enlarged lymph nodes, cancer is obviously one of those diagnoses. So coming in, he was very, very anxious, and he had all these issues he wanted me to answer for him. So first of all, as a clinician, there are systematic ways to figure out what was going on. After getting a proper history, the next step is to do a proper examination. So on examination, when I examined his groin, indeed there were some small mobile lymph nodes that I could feel in the groin area. The one he was talking about was on the left side of the inguinal region, and it was a little bit uncomfortable when I tried to feel the area. But actually, on both sides, both the left and right side, he had these lymph nodes. But the patient only was aware of the ones on the left side. The next thing to make sure is to figure out whether there could be any local infections that could be giving rise to these enlarged lymph nodes. So I examined his external genitalia, had a look at his lower limbs, and there was no obvious skin infection or skin lesions. So again, my working diagnosis at that time, enlarged inguinal lymph nodes. These were the various differential diagnoses I could come up with. So firstly was, could it be some local infection of the skin and soft tissues? Could it be some lymph nodes that were reactive to a recent sexually transmitted infection that he caught? Could it be cancer? Could it be some autoimmune condition? Could it be some sort of viral infection or some drugs? Was he taking some medications that could have caused the swelling? And then lastly, these rarer things that, like amyloidosis, sarcoidosis, those are, way down the line. But what is the most likely, or what do you think is the most likely cause of these enlarged lymph nodes? Well, it turns out these lymph nodes, when I reviewed all the tests that he provided for me, he actually went to Adventist a month ago and did a bunch of tests. The urine that he did actually was tested positive for this little bacteria called ureaplasma. Okay, so ureaplasma is not one of these common things that people talk about. Chlamydia, gonorrhea, HIV, syphilis. Those things are something that many people talk about. But these rarer organisms are also prevalent in the community. And then the doctor, at the hospital said that, oh, this is something you don't need to treat because it's a common bacteria. And it is true. Ureaplasma is a species, is part of the normal genital flora in sexually experienced males and females. But when you present it with symptoms, it's something that warrants treatment. And for this gentleman with the enlarged lymph nodes, I thought it makes sense that this could be the cause of his enlarged lymph node swellings. And ureaplasma, and just like mycoplasma infections, they have been associated with various genitourinary infections, non-gonococcal urethritis, and also complications for pregnancy. So what did I do with this patient? The management, I treated him with a course of doxycycline for 1 week, and I repeated the HIV test because, of course, he was still concerned, but that was not obviously the top diagnosis I was thinking about. And most importantly is counseling him about safe sex. The fact that he went to Thailand and to engage in that was really the underlying reason that brought upon all this anxiety. And of course, I followed him up in a month to make sure that the lymph node swelling comes down. And rather than doing all these blood tests and CAT scans, it made sense if it was still enlarged, we could obviously do an FNA biopsy of the lymph node just to make sure there's nothing too concerning. So the case learning points for me in this particular scenario is patients' perceptions of illness may not always may be different from what the doctors think. Factors that influence someone to seek healthcare include various things, socioeconomic status, sex, psychosocial distress, chronic symptoms, and anxious patients may consider some minor complaints to be very life-threatening, while other patients who are very stoic may tolerate extreme pain without admitting ill health. And the point is, presenting complaints may not be the only most important problem requiring the doctor's attention. What I mean by this is, someone coming in, for especially this patient with a lymph node, on top of his head, obviously he was worried about HIV. But for me, it was more important to kind of educate him that, yes, that's what you're worried, but you have to take a little bit look about your behavior, how we can mitigate and decrease his future risk of contracting other STIs. Of course, HIV is one thing, but if we could counsel him and change his behavior and help him in the future so he wouldn't have to present in such a manner. And finding out patients' underlying health concerns and reasons for consultation helps to avoid unnecessary costly investigations and helps to tailor-made your treatment plan to the individual patient. Effective strategies to foster sexual health and well-being. I split those in two parts. From a patient's perspective, is to demystify misconceptions and destigmatization. So, everyone knows, HIV is still a very stigmatizing condition. So, our job is to kind of relay people's fears and educate them and tell them to, really look into how to prevent this illness. Of course, reducing the number of sexual partners, use protection, vaccination, health promotion. Those are strategies that Dr. Yip was mentioning about, and I think we still need to continue to talk to our patients about these. But we cannot change the way people behave, but what we can do is to educate them and explain to them the importance that sexual health is a vital part of their overall health, and knowing one's HIV status is like knowing the your heart rate, and how, these are important things that everyone should be able to have access to. And then from a practitioner's point of view, I think teaching and training is important. Being able to teach the younger generation of doctors about how to take a proper history, how to approach these issues, understanding that the LGBTQ plus community have some unique health needs, and then whenever you have the opportunity to be proactive, not just deal with the presenting complaint, but also do some proactive health screening. And lastly, I think integrating sexual health into existing primary health care services can help to kind of offset some of the load that some of these clinics, these busy sexual health clinics are doing. So if primary care, I know primary care has a lot of things they have to do already, but if more and more general practitioners are able and adept to take care of these things, I think that having better access is always a good thing for our community. So here's a little bit about the LGBT Medical Society on the right that Nita was talking about. This is a society that I co-founded with a few other colleagues here in Hong Kong in 2018, and it's a space to really allow clinicians, whether you identify yourself as LGBT or if you are an ally, if you're interested in discussing about LGBTQ health, this is a space for you to you get to know people and how to promote and destigmatize LGBT health. Yeah, thank you very much.